Thank you for joining our AAMSC. And before I begin, I send my deepest condolence to the Hong Kong and Hong Kong families who lost their siblings and friends. Well, I'd like to deliver about the cell thing today. We're in the cell exosome session. My clinic name is Cell Clinic. It's a Cellinic. And this is basically based on my experience in Korea. To briefly go over my background, I started my career as a liposuction guy. So liposuction, I do the fat grafting, and then it goes to the stem cell, where we get the stem cell from the fat tissue, but we are able to get more this stem cell thing from other sources. Then I will go deliver quickly, but deeply as well. So this is our clinic. I built our Cellinic in terms of to focus as a stem cell treatment. So it's the octagon style, mostly in the hotel style. We're focusing on IV treatment based on high-end treatment. We are at the center of Seoul. I think many of you I see are familiar to have visited Seoul already. So a bit different style of the one that you know in the original traditional skin clinic. The reason why I'm showing this is we're very picky at choosing the product, especially in regard to the stem cell, the new generation thing, because our client, our patient, they want the best one and the safest one and the very state-of-the-art trendy one too. So to meet these three things is a bit tricky and hard. I begin with the stem cell thing, but also we do this treatment, a knee or a back joint as well. Of course, we do the aesthetic field of area. The reason why we're doing this is because we age. So if we're not aging, we're not becoming maturing, then there is no reason to talk about our stem cell thing. So 2016, when I began my career as this aesthetic area, so the HA filler, which is now also still in very much fad, is number one was. But now, not just inflating the volume with the HA or the collagen stimulator, now we have a more option to rejuvenate what we have. So this is, usually how we age. I'd like to show she is the president of one university in Korea, and imagine how old she is now. She's 94 years old. She is not just looking good with the volume and a lot of hair, but also she is mentally very, very, very clear. She was also on the podium giving a lecture at the age of 94. And she's infamous for doing everything she can, and exercise and the diet, so-called like a biohacking. If we have a Brian Johnson in America, she's the one doing everything in Korea. This is her reunion picture. Same age, her friend. So see how she well organized. And I am sure, I have my trust in our future stem cell thing. If we keep continuing this, our level of not just a body aesthetic field, but including mental or our facial or the body condition will be to the up-to-date to what we want. Today, I'd like to deliver about the NovaStem. I've been using this kit for 2 years. Now I say we're at the era of regenerative medicine to regenerative aesthetic. For the stem cell, we all have our stem cell. If you remember when baby fell over and have a bruises, anything, he or the baby will be recovering soon with about a week. I'm now today 44 years old. If I fell over now, it takes 2 weeks to get my bruises healed, which means I'm old. My stem cell gets less and less as we grow older. The basic concept of a stem cell treatment is to refill the less made this stem cell to us, whether it is our face or the body. The concept is the refilling that mesenchymal stem cell to us. Well, a lot of disease-based programs or the trials are now going on well with it, especially all these diseases. But with the NovaStem, I would not think that we're treating the disease basis because it's not that super powerful compared to culture basis. The sources we're talking about today is not embryonic stem cell, it's a mesenchymal stem cell where driven from your body to you. So 3 sources that we can draw our stem cell is the blood, which is the easiest one, but it takes time, but still compared to other bone marrow or the fat tissue, it is easy, just possible to draw your blood in your clinic. I always tell that the stem cell is mostly abundant in the fat tissue. So from the blood to bone marrow and the fat tissue. But in your clinic, if you see, not every doctor they could, but it takes time to learn this liposuction thing. So it takes the time, energy, and to be very competent to take that stem cell thing, you will need time. So we could go to workshop, but it takes time to learn to a certain liposuction thing. Well, probably to culture, you need maximum 50 cc, so it's a very easy process in the future as well. So blood and from the bone marrow and the fat tissue, we can make SVF, or we can use it to culture to treat. So it's very confusing about the idea, what is the difference between exosome or the PRP or the blood stem cell, lipo stem cell, or the cultured basis SVF. So I always give an idea that I bring like a BMW series. In BMW we have 1, 3, 5, and 7, right? So I always tell that our flagship is a cultured stem cell. You will need a laboratory and you will need the researchers to make the cultured one up to 200 million cells. And that's what we are doing, and Malaysia, I think, is famous too. And I truly believe it is the future of our regenerative medicine. But do we all need that big car 7? No, we don't need. Actually, maybe compact car is more in need. We don't need that flagship car. It gives too much gasoline. Some people like a 3 or an M5. It's your taste. Actually, it's our patient's choice to meet the needs. So I say 3 is the NovaStem. Then what is 1? If you don't like doing anything but want to begin the stem cell treatment in your clinic, go with the exosome. If you see the label of the exosome, it's mostly a human adipose tissue-driven exosome. So I always tell that the exosome therapy is the very beginning of the stem cell therapy. So that's BMW 1. So the 3 is a NovaStem. And the 5, we need the fat tissue liposuction, and we're making it to SVF. It will have energy to regenerate your meniscus or the backache, anything that treatment begin with at least 5 level. So 1, 3, 5, 7, exosome, NovaStem level, and SVF, and cultured basis stem cell. That is the protocol that we are having. Then, why? When we're doing the hematopoietic transplantation, this is how you do. We take both lines, you go to hospital, and it takes about 5 days to get this much of a hematopoietic stem cell. You need about 200 million to get healed if you have leukemia. That's the protocol. It's the same in the world, like in Korea, Hong Kong, Indonesia, Kazakhstan, anywhere. It's the same human body. If you have leukemia, it's already made protocol that you need 200 million hematopoietic cell to be cured. That's the deal. So, but do we have that much with the 120 cc only from the NovaStem kit? No, you don't. But when I meet our patient, they have an option. So for example, they come and then, as I said, from the 5 to 7, I need to get your fat thing. So you need to at least be on the surgery room for at least 30 minutes. But sometimes your patient or my patient, they would not go that much further. Or they are not under like a very bad condition to need that SVF or the stem cell cultured one. Then they ask, I don't want to go to a surgery room, but besides that, what do you have the best one? I want the best one for me without going any surgery, without doing any much complication. I just want the best one what you have. Then and this is the solution for your clinic. I've been using for NovaStem for 2 years, and the full clinical trial, I have many to share. It completely eradicates a blood cell, and then from the plasma, it's the key point of NovaStem is to have that concentrated buffer coat where least mesenchymal stem cell we're looking for, but a lot of concentrated hemopoietic cell that could go to paracrine effect and the stem cell stimulation. So that's the very key point of using this NovaStem kit. How does it work? It's very simple. You just get 120 cc, we centrifuge twice, and then we get that buffer coat in the center. We did about case trial, and I did a lot of research as well. I mean, the comparison lab search. We did a telomere and the anti-oxygen and NK cell hormone therapy. It's a bit weird to say that everything has been upgraded. The reason why I adopted this kit before 2 years ago was to prove that my SVF, my cultured basis stem cell is so good. So I needed the baseline. If this activated hemopoietic stem cell concentrate would be good for your condition, then it is unquestionable that the SVF and the cultural basis is truly can be the treatment for the disease basis as well. For this, we did a very much of a lot of lab thing, and the results are amazing. The telomere is actually has been lengthened. But it's not like a lengthening forever. It's lengthened up to the condition that you could have the best one. So there's a limitation of the telomere lengthening. So not just the concentrated action thing, we can use the plasma with the treatment of anything that you could do. We can mix it. So I use it with all our aesthetic field of area. So with the buffer coat, you can actually mix it with any aesthetic field of area. Why does it good? This is the thesis, them saying that combining stem cell with any of your aesthetic field of area will improve and prolong the cosmetic result and decrease the complication and ineffectiveness. Especially, as you know, this is era of biostimulator. What does biostimulator does? It actually tries to stimulate to enhance our collagen level by affecting M1 level to changing to M2. If it does not make well, it will end up with the M1, which will just give a scar. Mixing it with the any stimulator will give less inflammation and increase effectiveness. So it is not just necessary for the injection, but with the combination of any biostimulator or the aesthetic treatment now you're using, it's very good combination. This is recently has been the club, Genesis Club, who are using NovaStem, but every person is different. They have an OS doctor, we have plastic surgeon, one lady doctor is especially for the hair thing. So we're classing, we're accumulating classes, and we're getting more and more cases to share. So at this point, 2 years ago, I was very lonely to do only my case stuff. Now we have so many teams, so many doctors who do have it developing on their own research based. So this is only 3 times with the NovaStem, nothing else, because for the optional reasons. And then we can also, later part I will deliver idea about the PRF. PRF is a non-coagulated PRP. So it can become usable as of the, like a jelly, self-driven blood filler. So when we do, this is usually when I do demo on the left side first, and then I show them and then compare. So with the only PRF, nothing else, no non-HA, nothing, only from the derived NovaStem PRF, I do the left side, and this is 1 week later from the left compared to the right. So 2 years ago, I was only delivering this message by like injection local or the IV. But for after 2 years, I tried to combine a lot of more application with this aesthetic field of area. So it's not just limited of a regenerative general condition thing. It actually helps your combination therapy with your clinic. Especially, I know that you are using a lot of biostimulator, starting from PLLA, PDLA, PCA, whatsoever. So in the key message this, it's easy to use. I've delivered that this is BMW 13567. Not everybody needs 7. But if you don't want to go in the surgery room, what can you provide the best one? This NovaStem could be the best option for those who are looking for what do you have in your clinic, the best one. I want the best one. Then this is your option to provide. It will not just help like a general condition, but it will go align with your any combination therapy in your aesthetic area. Thank you for your very much attention. Thank you.